Welcome. My name is Becky Sanders. Thank you for joining us for today's Upper Midwest Telehealth Resource Center webinar series. And today we have a security expert with us. Scott Richards is with Purdue University, and he's been helping folks with clinics and hospitals and other institutes with their computers and security for over 10 years. So we are extremely happy to have Scott with us today. At this point, Scott, I'm going to turn everything over to you. Just a quick reminder, we are recording today's session. We will post it on our YouTube page and our website, and Scott is making the slides available as well. Please use the chat function for questions regarding technology if you have issues with today's webinar, and please use the Q&A to ask questions.
All right, well, welcome everybody. Just letting you know a little bit about me here. My name is Scott Richards, and as she said, I've been working with Purdue now for 10 years, going out to clinics and institutions and helping them keep their computers updated, helping them keep their computers secure. One of the fun things I get to do is play with all the new computers and things when they come out. I test about everything. So if you ever have questions, that phone number you see up there is my personal phone number. And you can call me anytime, day or night, and ask questions, even like what's the best computer to get. Believe me, I've played with about all of them. I've been doing this since 1985, and we'll tell you, quite frankly, I am a nerd. Star Trek uniform and everything. I love computers. I love doing this. I was asked to find a way for a lot of clinics to be able to do telehealth without having to go out and spend a lot of money. And this whole thing was designed for a very fast, easy way to do telehealth, and hopefully it'll make sense to everyone. So let's see. All right, first, again, telehealth. Just getting ready to set it all up here. It's really easy. Getting started with this, the main thing I'm actually going to be focusing on is Skype. I like Skype because it's in every platform. And so that everything I'm going to talk about today is basically setting that up and getting it easy to set up. So, okay, now there are telemedicine software that's out there right out of the box. You can go and buy them. Your EHRs, more than likely, also have an option for this. They usually cost a little bit more. Not really going to go into all these because of the fact that it would take forever. There's a lot of EHRs that have them. And also, all of them pretty much cost money. What I'm going to be talking about is ones that really aren't going to cost you anything or very little to set it up. And you can set it up. Now, if you have questions about any of these, though, you can contact me. And I can talk to you about it personally, and we can go over the different ones and which ones really work best, and if your EHR's telemedicine software is good or not. All right. So when do you want to use telehealth? Really for non-emergency medical issues, allergies, asthma, bronchitis, cold, flu, infections, fever, on and on. You see the slide. Or like now, when a lot of people are locked down and cannot get out, it just makes more sense. When it's not convenient to leave your home, obviously, like now, and if you're traveling and you need medical care, especially overseas, and you want to talk to your own doctor, it comes in very handy. Now, also throughout this, I do want to give a little warning. If you hear a bark, that is the thing of doing this from home. I do have dogs, and sadly, they are getting kind of rambunctious. Okay. Now, when you're doing this, one of the very first things you want to do is get patient verification. When you are talking to the patient or setting this up to set up the call, you want to verify the patient. You want to, use an ID, medical card, something along those lines, just to verify that it is the person you're supposed to be talking to. It is one of the issues that we run into. One of the, and HIPAA currently has really relaxed their guidelines a little bit for this, especially during the ongoing emergency. But you still want to try, if you can, get something in writing. I would actually even recommend when you have a new patient form, or your new patients, that you would fill out a form of some kind that would include telehealth and see if they're interested in it. All right, any questions on this so far? I'm kind of going a little bit quick.
Just as a reminder, if you have questions, go ahead and submit them through the Q&A function.
All right, now when you're doing this, you really need to set up a good location. One, you don't want it to be overheard by other patients. You want it to be somewhere that is sort of secured, and you want to make sure that, you know, you're not going to have people just walking in or, you know, grabbing something. I've had people set it up actually in a break room, which really wasn't a very good idea. Exam rooms are fine. Doctor's office himself, I have several clinics that have done that. And the best solution, though, would be a dedicated room for telehealth, something that you set up specifically just for that. All right. Now, for the patients, the best thing to do is talk to them beforehand, if possible, an email that you can send out, something with your standards. I'm sorry, dogs. It needs to be private. It needs to be room for the computer. And you need to have room to stand up in front of the computer, move around, especially if you're showing, you know, a part of the body that's not going. I apologize for the crazy dog. Is it very loud?
Yeah, can you shut your door?
Unfortunately not. It's an open concept house and it really doesn't do that.
Okay.
Okay. Give me 1 second here, okay? I'm going to try and maybe stop it. Okay. Now, the important part is the computer setup. What you need to actually get this going. And one of the most important things is, and the reason I picked Skype, is it doesn't require a lot to do it. Matter of fact, most computers already have it inside. 1 second, sorry.
As a reminder, if you have questions, please submit them through the Q&A.
I apologize for that. Again, the fun of doing this from home.
Thanks, Scott.
All right. Sorry about that. Okay, anyway, the computer setup requirements for Skype is very easy. That's what makes it really nice. And why one of the reasons I need to do it, set it up quickly. I can even walk people through it over the phone. It's very easy to do. For a desktop computer, the recommendations for this would be Windows 10. It's the easiest one and it's compliant. I don't know if a lot of people are aware of this, but Windows 7 is no longer HIPAA compliant. If you have any Windows 7 computers, you really need to upgrade them to Windows 10. Also, a USB camera and microphone. If you have a laptop, that's already built in. If you have to go out and buy one, they're as cheap as $39 for a really good one. And again, at the end of this, if you have any questions on that, I can tell you which ones to get. It's very nice and very easy to get them. Internet connection, of course, and access to your EHR while you're doing it. And if possible, a dual monitor. The reason for that would be you could have the EHR up on one and the video screen going on the other one. So it makes it pretty easy. A laptop computer, it is the same thing. Windows 10, internet connection, access to the EHR, dual monitor if possible. Nothing really changes there, except you do with the laptops have the added benefit of a camera and a microphone being built into it. So it makes it a lot easier. I would also recommend 8 gigs of RAM, just so that you don't bog down a little bit while running everything. Again, at the end of this, I can definitely give you great recommendations for ones that work really well. Now, this is actually a new type of technology. These are Android computers. Extremely inexpensive. They run Skype really well. They run private internet access, which we'll be talking about here in a little bit, which is how you protect your computers while you're doing the telehealth. And they do Bluetooth. You hook up a keyboard to them. They plug into an HDMI monitor. They're extremely nice, and they can basically run anything that you'd need to do. Skype actually runs a little bit better on it than Windows 10 as I've run into so far, just a little bit clearer, so it's very nice. And again, links and all that are available. All right, now the software, Windows 10. The reason I say Windows 10 is because it is the most current version of Windows, but if you're running an Apple computer, Skype is available on Apple's as well. Another reason I like Windows 10 is it has Microsoft Security Essentials built into it. So even if you're a very small clinic that doesn't have a server or anything like that, it's very easy to set this up and make it secure. Skype, for my choice for video conferencing and talking to them, would be basically because it's available on every platform. It is really easy to set up. It's basically on phones, it's on laptops, tablets, just about anything. And then private internet access, we're going to talk about a little bit. It is a way of protecting your computer from hackers and securing your call with your patients. Now, if I'm rolling a little bit fast on this, let me know. People need time to type in anything. Okay, so Windows 10. One of the important things about Windows 10, if you're running it, is you want to make sure that all the updates are current. I know it's really annoying. Windows 10 does have a tendency to send out boatloads of updates, but they are really essential. Like whenever there's a new virus, whenever there's something new that comes up that somebody's hacked, they roll those updates out, and it really helps to keep everything updated. Internet access, of course, you're going to need that. Which if you didn't have that, would probably be having a problem anyway. And then access to your EHR. I had a couple people that were doing the telehealth and writing it down, not actually being connected to the EHR, and some bad things sort of happen when that occurs. So if you can, definitely want to have the access to your EHR. Okay, so Skype, let's talk about it a little bit. It's located in the Microsoft Store. Let's see, saw a couple questions here that came up real quick. Will Skype be compliant with CMS requirements? Yes, actually it will. I've actually been told that it is actually being recommended. So far, yes. If anything in that changes, I would definitely let everybody know, but right now it's looking like that is going to stay. What about Zoom? Actually, which is funny because it is what we're using. There's actually been some hacks on Zoom. And the problem with Zoom would be the fact that everyone can get Skype on anything. Very easy and very fast to set up. Whereas if you are doing it, Zoom is not available on absolutely everything. And it takes a little bit more setting up. On the slides that you also can pick up, there is the links to a tutorial straight from Skype, how to set everything up step by step by step. It takes less than 3 minutes. Extremely easy to do. There's also a link for the patient. How to set it up with the patient, how to send the patient information so they can connect to you. It's really nice. Those 2 tutorials can teach you basically every single thing you need to know. And they're about 5 minutes each, not very long at all. Again, the reason for Skype, because it is compatible with Windows, it's compatible with Apple, Android, Linux, just about anything. And if, let's say, they don't have a computer, but they do have a phone, Skype is on phones and works extremely well with Apple phones. It works extremely well with Android phones. Even the old Microsoft phones actually had those as well. And the Blackberries. So literally every place has something you can use it with. And again, it works on the laptops, desktops, tablets. Oops, sorry, here my computer is deciding to hold up a little bit. Okay, now, one of the things I really recommend is if you're going to be doing this, is getting a VPN, a way of protecting your computers from hackers. It is extremely easy to install. The one I recommend is Private Internet Access. They're very $6.95 a month, and that's for like everything you have. So if it's your phone, it works on phones, it works on tablets, it works on laptops, it works on desktops, and you literally can go and hook it up, not per machine, but like $6.95 for all of them. So extremely nice. It encrypts your Wi-Fi. So basically nobody, if you're on Wi-Fi, nobody's going to be able to hack into your system while you're doing your telemedicine. It has peer-to-peer support, which means it is going to do an encrypted tunnel. So nobody's going to hack into it that way as well. It is extremely nice. If you are traveling, sorry, that just rolled up. If you're traveling and you're using Wi-Fi anywhere, and I'm sitting in the same room with you, I can hack your machine in less than 30 seconds. Virtual private internet access, a VPN, allows you to basically secure it. If I'm sitting right next to you and you have this running on your computer, I will not even see you're there. If a lot of you are using Comcast or a lot of the other service providers, you may not know it, but they can actually see the websites that you go to. If you use this, they cannot. It makes it extremely nice. And I recommend it for the patient, for the doctor. You literally will click on one little button and it will connect, and that's it. You don't have to do anything else. So extremely easy. All right. Again, it works on laptops, desktops, tablets, and phones. Here. Now, this has kind of been an extremely quick roll through of this because of the fact that it's kind of interesting doing this without a lot of questions coming in. But, you know, if you need help with any of this, like setting up Skype, talking about it, anything like that, you can call me up. Again, that is my personal cell phone. You can also email me at Purdue, and I definitely can help you walk through it. It's very easy to do. Is there, Becky, do you have questions, things?
No, I'm going to open it up again for questions and see if we have anything else out there. Thank you very much, Scott. That was quick and down and dirty. Okay, here the questions are rolling in.
Yay.
What if patients cannot, I'm assuming this is cannot afford the VPN? Is their concern of hacking on their end?
If they're running Windows 10 or, you know, pretty much, well, I'd recommend Windows 10, but if you are running private internet access on your end and they're not running it on their end, it is going to give you a level of security, and Skype itself is very secure. Now, if they've already been hacked, then that'd be a whole different story. But if they don't and can't afford that, you can still do it securely.
Okay. Another question, is there any need to have the VPN if you're on a secure hospital network?
No, not really. If you're actually doing it from a secure place and they already have their own, then no. I was actually bringing that mostly for smaller clinics, and also for your patients. And it's something to talk to your patient about because it really is important. Something that's inexpensive, it really does protect them, not just when doing telehealth, but on all their computer stuff. I can't really emphasize it enough. I do another class just on mobile security, and it's really necessary nowadays. Sad to say, we have a lot of hackers out there trying all sorts of things. My Chihuahua decided to join in. Okay.
Any other questions?
We have one question from one of our panelists. It said he mentioned Zoom isn't the best for TH. Is it okay for a provider does VPN? Does that help the security of Zoom?
Yes, and when I say that, especially how it is currently what we're using, there's just a few little odd glitches with Zoom. I mean, there was a hack. They did get hacked. But they were very fast at fixing it and getting on top of it. I mean, anything can get hacked. But myself, like setting this up for Zoom, one of the things I noticed is my camera light, once I've loaded Zoom, is always on, even if I'm not running Zoom. And I re-imaged my computer, re-put it back out there, light was not on. Loaded Zoom and the light is now on again, continuously, which from a security standpoint, if you ever see your camera light on, something really bad's going on. I don't know if it is just something, which, by the way, this afternoon I'm going to be doing this whole thing on figuring this out. It could be possible that the type of camera I have, once it's initialized, it is somehow staying on. No other program does that, but I have run into that with Zoom, and it's just a little bit of a concern.
That's interesting, Scott. Because I have a Logitech, I think it's a 610 maybe, I don't know. But I haven't had that happen with Zoom. We here at the Rural Health Association and the Upper Midwest Telehealth Resource Center use Zoom a lot. And I do know many medical practices are using Zoom. There are a slew of new guidance for security protocols and all that kind of stuff after they were hacked, and they've been doing updates sometimes twice a week.
Yeah, I set it up on a laptop, played with that, did not happen. I set up some other things. My computer I built myself. So there's a real possibility that something in that is triggering it, which is why I want to figure that out.
Right, absolutely.
But I mean, I wouldn't be super concerned using Zoom. Otherwise, I wouldn't be using it now.
Right.
But again, it's just anything can be hacked. And you just need to keep on it. The one thing good about Zoom is, of course, they've got a whole dedicated group now all over it. So is one of the reasons I do like Zoom. It has some really, as you're saying now, amazing features. The other one very similar to that would be Skype for Business or Teams, which is what that's turning into.
Yeah, I've seen a lot of people start to use Microsoft Teams.
Yep, well, it's what we're using now at Purdue, and so far it's been pretty neat. It's really great for calendaring and that sort of thing, so very nice. I like Zoom for the whole background thing you're seeing there, which is kind of neat. They're nerdy kind of stuff. Let's see.
Yeah, we've got another question. I saw that the Office for Civil Rights at the Department of Health and Human Services said they were changing HIPAA enforcement for the duration of the virus. How does that affect telehealth technologies we can use? And do you think it will change back after the virus?
Well, it definitely will change back after the virus as far as enforcement. Basically, I'm not a big fan of HIPAA. I'll tell you that right now up front, because what I do for Purdue is going out to doctors' offices and help them be prepared in case HIPAA ever audits them. And is one of the things, I think it's a little more adversarial than I think it should be. It should be more of a partnership. And I see them moving that way, which I'm hoping will continue. But at the moment, yes, they loosened a lot of things, especially in telehealth part of it, because they want people to be able to contact their doctor and all that. I don't think they're really going to restrict the telehealth end of it. I actually see that as more of a future thing that really is going to be coming down. There are some amazing technology that is currently being designed. One of them is a sort of a bed that you can have in your house that's sort of like Star Trek in a way, that is connected to all sorts of sensors that Microsoft is currently developing. It's very neat, and is something that they're working on, like an entire household mini office, doctor's office, that then can tie into a doctor. And I see the future really coming more and more to that. And the main thing they want to make sure with the telemedicine is that somebody's not going to be able to hack into the stream, obviously. There'll probably be some requirements, a VPN, being able to encrypt the transmission, one that is going to do a good job of that. So they wouldn't want you to do just a straight call with video, which you can do with phones and things like that. That's really not very secure. But Skype is pretty good, and so isn't Zoom actually for that end of it. I mean, the hack that happened to Zoom was kind of a freak programming thing. But other than that, it's extremely well done. So I don't know. I think that the regular stuff, I think they'll probably even double up on after this, especially if you're using Windows 7. I really cannot stress this enough. If you are currently running Windows 7, jump to Windows 10. Because that's something they're really going to get on, because there are all sorts of hacks now running out for that. Because once Microsoft stops supporting it, every hacker on the planet starts designing stuff to attack.
From a policy aspect, Medicare has said that right now, whatever system you use has to have both an audio, visual, real-time communication. They have added a handful of audio-only CPT codes if the person that you're working with does not have any type of video available to them or don't have adequate broadband to run video. In the Upper Midwest Telehealth Resource Center region of Illinois, Indiana, Michigan, and Ohio, each Medicaid program tweaks the language just a little bit. They are allowing audio only in some cases, and sometimes they have specific codes that don't get paid the normal CPT rate. But they have said that with the waiver of the HIPAA compliance rules, you can use things like FaceTime or Facebook Messenger video chat, but not a public-facing thing like Facebook Live or TikTok and some others. So great question. Any other questions? Also, as we wrap up today, I'd like to turn your attention to the chat function, and we have a really quick survey, SurveyMonkey survey out there. If you would answer those questions for us, we would greatly appreciate that. And Scott, once again, I want to thank you for bringing this information to us. I really appreciate it, and it's great information. Great to hear from somebody who's out in the field trying to break things.
It's always fun. And again, I really can't stress this enough. I truly love what I do. And that phone number up there, you can call me, you can text me. I test all new computers pretty much. I can tell you which ones are great for clinics that are very inexpensive, because it's usually not the expensive ones that are the best. I also can help people if they're trying to set up Skype and they just got some questions. You can definitely call me up. Doesn't cost you a penny. I love it. I even get phone calls in the middle of the night. I don't care. I'm a real nerd and just live for this sort of thing.
Very good. All right, last call for questions. As a reminder, we have recorded today's webinar, and we will be posting that on our YouTube page, and there will be a link as well as a link to the slides on our archived webinars on the UMTRC events page. Thank you once again, Scott, and everyone have a great rest of your day.